Hi, my name is Dr. Nicole Alexander Scott, and I'm the director of the Rhode Island Department of Health. I'd like to talk to you today about palliative care. Palliative care is a relatively new field, and it's growing quickly. This means that more people are becoming familiar with it, but it also means that there are some misperceptions out there about palliative care. By talking a little about what palliative care is and what it is not, I hope that you'll walk away with a better understanding of this option for patients and their families. That could mean for you or your loved ones. Palliative care is a specialized kind of medical care for people with serious illnesses. It focuses on providing relief from symptoms and from stress. The goal is to improve quality of life both for the patient and for the patient's family. Palliative care is coordinated by a specially trained team of providers who work together with a patient's doctor to provide an extra layer of support. It is appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment such as surgery or with chemotherapy. Palliative care can address patients' physical, psychological, spiritual, and social needs. It also helps patients and their caregivers with decision-making and planning for further treatment. Some people assume that palliative care is only for patients who are dying, but that's actually not true. Even though palliative care is an integral part of hospice services, which provide comfort and support to patients and families during the last 6 months of their life, palliative care is also a medical specialty. People who choose to use palliative care often continue to see their other healthcare providers. And like other specialty care, doctor and nurse practitioner services are covered by most insurers. Palliative care team members can include specially trained physicians, nurse practitioners, nurses, social workers, spiritual care providers, therapists, providers of integrative therapies, and many others. So, what kind of patients receive palliative care? Palliative care patients often have progressive chronic diseases such as congestive heart failure, chronic obstructive pulmonary disease, or COPD as it's sometimes called, emphysema, cancer, kidney failure, and neurological diseases such as multiple sclerosis, ALS, or Parkinson's disease. Palliative care can help with the symptoms of many of these illnesses, such as pain or discomfort, shortness of breath, fatigue, anxiety, depression, lack of appetite, nausea, and constipation. Palliative care really comes down to coordinating treatment to help a patient meet his or her quality of life goals. For example, someone who wants better pain and symptom management might need to see a pain specialist, a physical therapist, a massage therapist, a dietitian, and other types of care providers. A palliative care team can arrange all of these different types of care in a way that's responsive to the patient's choices and in a way that empowers the patient to become an active participant in their own health care. Research has shown that palliative care can improve quality of life. It can also decrease unnecessary hospitalizations and even extend life for some patients. Palliative care can start at the moment of diagnosis, or it can be added at any point through the course of an illness. However, as is the case with most courses of treatment, it is often most helpful if it is started early. Unfortunately, Children, as well as adults, sometimes have to cope with some of the serious illnesses that I mentioned earlier. As an internist and a pediatrician, I've seen firsthand the pain that children experience when they are extremely ill. And I've also seen the pain from the side effects caused by curative treatment, also those caused by anxiety about diagnoses and by fears about an uncertain future. Pediatric palliative care teams can help. They guide children and their families through these kinds of ordeals. They don't replace a child's active treatment team, but instead, the two can work side by side to give the child and the child's family the care and the support that they really need. Pediatric palliative care begins when an illness is diagnosed and continues regardless of whether or not a child receives treatment directed at that disease. Children coping with serious illnesses or chronic diseases deserve the opportunity to grow and develop as all other children do. Pediatric palliative care can help families adjust their expectations about the course of an illness and its treatment, and can find ways to allow kids to just be kids. This could mean having a birthday party, dressing up for Halloween, or just playing and having fun. There are few moments in life that are more trying than when we or when someone we love is dealing with illness and pain. There often isn't any easy cure, but the kinds of physical, spiritual, and emotional support that are available through palliative care can be true blessings for the patients and for their families. If you or someone you love is facing a serious illness, consider talking to your doctor about whether palliative care is the right option for you and your family. Life matters, and quality of life is so important. Thank you.